Okay, thank you everyone for being here. Special thanks to our media providers. I deeply appreciate you getting the word out to our residents and business community of the city of Springfield. Again, I'm very, very appreciative, deeply appreciative with everything that they have going on, that Dr. Kerouac, the President, CEO of Bay State Medical Center, is here, and Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital, is here. After I open up, we'll go directly to them, and then we'll go updates from each and every one of my cabinet heads. Let me give you some updates, and to each and every one of our residents and business community, thank you for what you continue to do and sacrifice. I know it's been difficult challenges right now, being away from loved ones and friends, but these continued proactive measures, though they seem simple and common sense, are very, very important. The quicker we can continue to do this, the better we can continue to do this, the quicker we'll be able to get back to normalcy on that. So I know it's a sacrifice, but it's extremely important. City government will continue to operate, and I want to thank all my employees, from cabinet heads down to rank and file, many who are working 24/7 to be able to provide for you. And I want to thank each and every one of our families and your families too, because they're sacrificing. But we will get through this together for the better and as one. So quick updates here. Just to let you know, tomorrow, Congressman Neal, who's been very helpful on the federal level, we'll be having a conference call on this, the support package that's coming from the federal government and how we can make sure we take advantage of that. Governor Baker again announced that state income taxes or state returns are not going to be due now July 15th. They'll run concurrently now with the federal of July 15th. My Commissioner of Health and Human Services, Helen Carlton-Harris, will be coming up. We are now, as of yesterday, we have not received the update yet here in Springfield, up to 45 that have been confirmed with the COVID-19 coronavirus, so that is 45. We will also be sending a letter to Governor Baker, Lieutenant Governor Polito, and Congressman Neal as this federal money comes in to make sure that Springfield is able to garner any and all reimbursement. We continue to front hundreds of thousands, if not millions of dollars, to do the right things for our residents and business community. I am very thankful to Governor Baker and to Colonel Mason of the state police, who offered, I believe it was late, Cheryl, I don't remember, it was Friday night or Saturday night, reached out to us through my Chief of Staff, Tom Ash, 9 state troopers, all who are very familiar with the city of Springfield, and I think probably worked in our C3 units, 3 per shift, will be coming here. We appreciate that immensely. I did visit the homeless, our tent triage area. These are massive tents and that have been set up across the street logistically. We made 110% from the Friends of the Homeless on Worthington Street. I'm very deeply appreciative of President John Cook of Springfield Technical Community College for allowing us to use those parking lots there. Very impressive structures that went up, and I want to thank Pat Sullivan, my Wizard of Oz. He'll be speaking about that, and Helen Carlton-Harris, how that will be manned. And I also again want to thank the Bay State Medical Center, Mercy, and our homeless providers as we move forward. I think a special thanks to Sheriff Nick Kochi. He was in conversations with Commissioner Cheryl Clapprood, and masks are being made, which are going to help our first responders, and the sheriff's also going to be able to clean and launder them and steam them, which is extremely important. Springfield, we made a lot of these moves. We're ahead of the curve here when it comes to moves we made, I see, with other parts of the state, with our basketball hoops being taken down last week. Our playgrounds have been cordoned off. Our first responder testing, and again, thanks to Bay State and Mercy, especially Bay State, for our first responders, that they're getting tested ASAP. They're on the front lines. We also have hotels on calls if knock on wood, if a massive situation occurs for our first responders. The homeless, the triage center, the tenting, we're ahead of the curve on that. That's going to be ready to go. And the Tim Sheehan, my Chief Development Officer, again, we're ahead of the curve with the restaurant grants that we're putting forward. Now we're trying to develop, we will be developing a small business grant funds from HUD funding on that, and that's to be announced shortly. Very thankful again to Governor Baker and to General Keefe. I wanted to make sure it was first in line with the National Guard, and I've requested 75. Right now, Commissioner Clapwood is down 22 officers. I believe Commissioner Calvi, our Fire Commissioner Bernard B.J. Calvi, is down 4. We want to be ahead of the curve if needed. Those National Guards, men and women, are very, very versatile. They can be used in a myriad of actions with the city, whether it's public safety, whether it's with a homeless situation, anything that we need. So that request has gone in, and we're waiting to see what we're going to get. Again, we have 4 police officers that are down. I have spoken to each and every one of them to wish them good health, a speedy recovery, and encouragement. The school meals and students and families has gone fantastic. About 42,500 as of last week. 20,000 meals went out Friday, because we make sure that those students and families are fed over the weekend. Senior continues to be delivered. I think there was about 75 or so that needed it. We made sure they were fed. We also want to keep the public updated, so we do these briefings or as needed, but you can please go to www.springfield-ma.gov and/or call our 311 call center at 413-736-3111. With that, I'm going to turn it over very shortly to Dr. Kerouac and Dr. Roos. On the educational front, Superintendent Warwick will speak on that. We're doing more and more laptops or computerization for our students moving forward, and we're also working on a MOU, utilizing our school nurses to help out Helen Carlton Harris on tracing and tracking. Everybody's working together, and that's extremely important as we move forward. So why don't I move away and bring up Dr. Mark Kerouac, the President and CEO of Bay State Medical Center. Thank you. Thank you, Dr. Kerouac.
Well, thank you, Mr. Mayor. Good morning, everybody. We really appreciate your leadership during this crisis and the cooperation we've gotten from every member of your leadership team and the support of our legislative delegation. This is the 3rd weekly briefing we've done, and I have to say, to me, it feels like a year goes by between each one. A week ago, I announced 39 positive tests at Bay State Health. Through yesterday, over 1,300 tests were performed. 222 have returned positive, 870 negative, and 292 still waiting. The number of pending test results as a percentage of the total has been going down, which means that the turnaround time is speeding up, and that's really good. The big news for us this week is that we've gotten a commitment from Roche Diagnostics to begin in-house testing at our main lab in Holyoke this week at a level of 200 tests a day. We hope to increase the number of tests per day beyond that using other smaller platforms and also our current send-outs to a variety of labs. As soon as we reach a certain level, we're interested in developing distributed testing sites throughout the region for our patients. We're continuing to follow the hierarchy, though, the prioritization scheme. First, testing healthcare workers, first responders, and inpatients who are suspected of the disease, as well as people who are known contacts or contacts of known positives. I don't know when it's going to be that we are able to test people with mild flu-like symptoms. We'd like to be able to do that, but it really depends on the availability and the capacity for testing. With respect to hospital capacity, as of yesterday, there were 106 positive patients across our 4 hospitals and 52 with suspected disease who are on isolation. 34 required critical care levels of care. There's been very creative approaches to surge planning, utilizing operating rooms as intensive care rooms, for example. And we ultimately believe that at Bay State Medical Center, we'll be able to get to 500 beds, 150 of them ICU beds. We are also housing our COVID positive patients in separate units and separate ICUs. There also are separate clean units and clean ICUs in different parts of the hospital for patients who have other problems like trauma, heart disease, cancer, etc. Not only I, but the leaders from across the state have been impressed by the flexibility and ingenuity of our hospital operations leadership team. We continue to work hard to protect our courageous healthcare workers. We're working to source personal protective equipment, or PPE, through multiple sources, dealing with a whole bunch of new vendors, uncertain as to whether any given order is going to show up, as the governor noted in the paper yesterday. We are very appreciative for donations from the manufacturing industry and for the mediation of that giving with the Economic Development Commission. We also continue to work with a number of local manufacturers to produce a more reliable local supply of these sorts of this sort of equipment. Right now, I would say that we are neither dangerously low nor are we oversupplied. Every day we hustle to keep up with the demand. Importantly, we have added PPE coaches 24/7 at all of our hospitals. This was found to be very important during the SARS epidemic because oftentimes people, even when they were using the right equipment, weren't using the right technique, and they were contaminating themselves when they were taking it off by touching the outside of their gowns or masks. This has gone a long way to sort of helping people feel confident that they will be protected when seeing a patient who's infected. We've also done a lot of work to try to reduce the stress on our employees. There are now 3,500 Bay State employees working from home. As a result of canceling elective surgery, we've been able to redeploy many of the caregivers to other roles within the system. We've also accelerated testing and the return to work of the folks who are out on quarantine or those who simply developed respiratory symptoms. We've moved our parking from off-site to on-site, which has been a satisfier with employees, and provided support for finding childcare and for reducing stress. For those who could not be redeployed and still could not work from home, we're announcing a furlough policy with full pay and benefits, and we fully expect we'll be calling those folks back into the fight very soon and are not planning any layoffs. We're appreciative to our loyal blood donors. They have managed to find our new donation center up in Holyoke on Whitney Ave, and we encourage everybody to consider donation if you're able. I'm also grateful to the local media. I think that the coverage has been steady. It's been very fact-based, and I think it's really helped our community respond in the right way, so thank you for that. I'm appreciative to our senior leaders at Bay State Health. They've been planning in a disciplined and imaginative way for many weeks now and have been able to stay a step or two ahead of this fast-moving problem and dealing with issues and problems that none of us had ever encountered before. But I want to reserve my greatest thanks for our healthcare workers. Today is a little-known holiday, believe it or not. It is Doctor's Day. And so many of our doctors are, yes, we appreciate it. And I think many of them today are living out the meaning of what really it means to be a doctor, which is to be dedicated to the care of patients even in challenging circumstances. I rounded last Friday on all of our COVID positive units, and I have to say I did see the concern and the worry in the eyes of many folks, coupled with, at the same time, a deep sense of commitment and can-do attitude. To me, it really is courage, and by courage, I don't mean the absence of fear. I mean overcoming your fear and doing the right thing, answering the higher calling of healthcare, and I'm seeing that day in and day out on our units. We know that this thing is going to be over, hopefully in a few months. That's the current forecast. And that we'll be all able to return to normal activities as a community. I expect appreciating them more than ever. The only question is how much of a toll this is all going to take. And that is where all of the members of our community have a big role to play. I'm grateful for the sacrifices that so many are putting forth in terms of staying home and restricting their activities. And it really does help keep the numbers of people coming to our doors lower and more manageable. So please keep it up. Please follow the governor and the CDC guidelines on social distancing and protecting yourself and your families. And thank you very much.
Thank you, Dr. Thank you, Dr. Kerouac, very much to you and your staff and your frontline individuals for their continued brave and dedicated work. Before I bring up Dr. Roos, also I wanted to mention, I think Helen will go into it a little bit too, that it's just for people that have friends or families, we're noticing a trend of many coming from the New York area, New York City, and you need to be cognizant of those individuals coming here or to your home, that you might need quarantine aspects, but we are noticing an uptick of New York individuals who have family or friends here in the Springfield area coming. That's for your good, our good, everybody's good, that you should be cognizant of that. 90 meat outlet we had to shut down, and they'll follow the proper procedures to get open up, I think sometime maybe possibly in April. Early April on that. We wanted to make you aware of that. The big key word, N95 masks. Anybody listening, we need N95 masks yesterday. Not only for the hospitals, but for my city employees, especially my first responders. Again, we're working from the federal level on down, so that not only government, but also to the private vendors. N95 masks as soon as possible, please. Without further ado, again, I'm very happy and pleased that we have Dr. Robert Roos here, who is the Chief Medical Officer of Mercy Hospital Trinity, and our continued partnership. Dr. Robert Roos.
Thank you, Mayor, and good morning, everyone. I too want to thank you for your leadership of the City of Springfield and the leadership of all of the commissioners during this incredible time. On behalf of Mercy Medical Center, I also want to thank our legislative delegation, both federally and locally here, for their support and their continued efforts. With each passing day, it becomes more and more clear that these are unprecedented and in some ways uncertain times. And as the COVID pandemic evolves, we are all called upon to learn quickly, respond decisively, collaborate effectively, and constantly shift how we do things. In the span of just the past few but remarkable weeks, we've all changed the ways in which we've lived, worked, and interacted with each other, with our families, with our communities, and with our colleagues. And to support safety and public health, we now all practice physical distancing and staying 6 feet apart. Yet we work and improve our social connectivity through telephonic and video means. We are following new health screening guidelines, both for patients, those visitors, and our colleagues, and we have adapted to new guidelines for the use of protective personal equipment. Those are only a few of the ways that we have transformed our lives in response to COVID, and undoubtedly over the course of the next many months, there are going to be others. We've also learned a few things that is important for others to know. We've learned that the clinical presentation of this illness can vary somewhat from the triad of fever, cough, and shortness of breath. There are now revised guidelines by some societies that changes in smell and changes in taste can be indicators of an infection with this coronavirus, as well as in some cases the onset of gastrointestinal symptoms or even abdominal pain. At Mercy, we've taken this information and communicated to our providers such that we ensure that we have the appropriate threshold of screening at our entrances to ensure that we're identifying potential persons with this disease as early as possible. We've also learned that although the elderly and those with pre-existing conditions like lung and heart disease are the most vulnerable to some of the severe complications, that the illness can impact and has impacted many young people who can be vectors for transmission to those most vulnerable in our community, and in some cases even younger people can fall victim to some of the severe complications. And there is emerging risk factors that perhaps obesity may be something that can influence that development. And so at Mercy, we have taken the steps to ensure that we are following up with each and every person that's had a test for the novel coronavirus and performing follow-up calls several days later to anyone testing positive, because we know that while the majority of individuals will have mild disease, in some cases it can worsen, and it can worsen quickly. So I encourage everyone to ensure that they are monitoring their own symptoms and reach out to their provider immediately if there is something that's of note or concern. We've also learned, and this is something over the course of the past several weeks, that we know that there are times in which the asymptomatic, people who are not showing significant symptoms, may be able to transmit this infection to others. And so at Mercy, we've revised our guidance. And this is something that is evolving, and we will evolve too. We've revised our guidance for the use of personal protective equipment to recognize that for healthcare workers that are working on units with persons under investigation, that they should always be donning a surgical mask. And in other areas, that we are allowing other workers to wear masks, surgical or homemade, in the event that suits them. And as we've seen our test results come back more frequently, more readily, and we've been able to expand our testing, we've also learned that community spread is still very much present. And that as individuals travel between states and geographic areas, that could lead to the further expansion of the pandemic. As of this morning at Mercy Medical Center, we have tested 536 patients through our emergency department and inpatient hospital. We have had 72 positive tests, 259 negative, with 205 still pending. The turnaround time continues to improve, but is not yet where we need it to be, and we have made progress in working with both Abbott and others to be able to bring in-house testing to our labs in the coming weeks. We continue to see increasing acuity and severity of cases through our emergency department and in our inpatient hospitals, with right now 18 patients with confirmed COVID infection being treated at Mercy. And over 30% of our inpatient hospital is currently a person under investigation or with a positive infection. We have moved into our level 2 of our surge plan regarding our critical care areas, and we have created a person under investigation or COVID-only intensive care unit, as well as COVID-only med-surg and telemetry units, so care can be delivered directly and appropriately to those patients, while other patients with other conditions can receive care in separate spaces. We've expanded our capacity, we've trained teams, and we've deployed new providers in new ways. And over the weekend, in communicating virtually around the clock, I continue to be consistently impressed and inspired by what's happening in regards to planning, training, and response. Our critical care, emergency department, hospital medicine, and anesthesia providers have been tremendous. And we have nurses from our post-anesthesia care units providing care in new ways for critical patients. Throughout our system, our focus remains strong on ensuring that we have the supplies that we need to protect our most vital resource, our healthcare workers. And our focus, as the mayor mentioned, is also on N95 respirator masks, as well as on the supply of isolation gowns. We are grateful for the receipt of materials from the Strategic National Stockpile, but recognize that that only contained a few days' worth of supplies based on the current levels of utilization and the expected use over the next few weeks. I want to express gratitude to many organizations and individuals throughout the community for donations, from hand sanitizer from Mass Mutual, to shower caps from the Sheridan, to Sheriff Kochi and others for respirator masks, and our construction and manufacturers for additional supplies. The support of the community has been tremendous, and it is going to immediate and good use. If individuals want to continue to make donations, I'll direct you to our public-facing hotline at 888-786-2798, or directly to our loading dock at Mercy Medical Center. In regards to treatment, which is something we haven't talked much about with this novel coronavirus, we are developing a committee of regional experts to review the latest evidence of treatment regimens, as well as seeking approval to participate in trials for new medications that may prove to be effective for treating COVID. And I want to commend the mayor and the commissioners on their efforts regarding finding locations of care and improving testing for the most vulnerable, our homeless population. We are grateful to be collaborating in this way, and we too are focusing efforts on those that are impacted by this, that are often marginalized from routine care, patients in nursing homes and homeless individuals. We continue to focus on safety first and foremost, and we have continued to revise our procedures and are now screening not only any allowed visitor or vendor or outpatient, but also all colleagues for their temperature checks upon entry to the facility. At this point, we just don't know the length and the severity of the pandemic. We don't yet know the effectiveness of a future vaccine, and we don't know if this infection will recur year after year. But I do know one thing. We know that if we take the proper precautions in physical distance, that if we employ diligent hand hygiene, that if we isolate and quarantine, that we will flatten this curve. And together as a community, if we continue to care for each other and ourselves, that we will certainly overcome. As Dr. Kerouac mentioned, I too was reminded this morning that today is National Doctors Day, where we recognize the importance and the value of service of some of our critical frontline providers. I could not be more grateful to all of our physicians, clinicians, and providers throughout Mercy Medical Center and its affiliates for everything that they are doing each and every day. I've had many folks tell me that when they wake up each morning, it feels like they're going into a battle. And we want to ensure that they have the tools and resources to be able to carry out that courageous calling. It's our legacy to be a transforming, healing presence. We will continue to transform what we do to be in the best position to heal. And as citizens, I urge you also to do your part to protect our resource of providers and healthcare workers and first responders. Thank you for all your support and all that you're doing.
Thank you, Dr. Thank you, Dr. Roos and Dr. Kerouac, and to all your staff, from doctors and nurses, rank and file, for everything that they continue to do. You're doing yeoman work. And to all our grocery store workers and the smaller stores or convenience stores. Thank you for what you're doing. You're a lifeline to all our families, and you're not forgotten either. My Commissioner of Health and Human Services, Helen Carlton Harris, who has been my point person, has done yeoman work, as have all my cabinet heads and rank and file, but she's really been going around the clock, and she will give you an update and her perspective on a multitude of issues that we're dealing with. Helen Carlton Harris. And she looks sharp again today.
Thank you, Mayor Sarno, for your leadership and for your support. I stood before you on March 6th and I told you that there were no cases of COVID-19 in the city of Springfield. Today, as the mayor said, there are currently 45 cases positive that I have been informed of through our Maven system. I want to be clear that that number is exceedingly low, because all of us know that there are more cases there, and there are investigations going on, not only in the city of Springfield, but throughout the Commonwealth of Massachusetts. In the Commonwealth of Massachusetts, there are a number of positive tests that we have that have been given to us. It's 4,494 positives out of all of the tests that have been done. That's a significant number at this point. I anticipate that that number is going to grow. So it's important that we recognize that we are really, I believe, in Massachusetts at the tip of this iceberg. I believe we're going to see over the next week to 14 days, if not longer, these numbers continue to rise. So once again, Dr. Kerouac will remember that during the AIDS epidemic, we told individuals, it's not what you look like, it's what you do. We want to remind everyone that we should behave as if everyone in our environment has COVID-19. We want to make sure that the things you do are the things that you have heard from our medical experts. I'm grateful for the partnership of Mercy Medical Center, Bay State Medical Center, and of course the Trinity Health Systems. We have talked about social distancing, each one of us. That is the way in which we are going to have a measurable difference. None of us are enjoying being away from our loved ones and not being able to touch them. None of us are enjoying the fact that there are individuals dying and we can't be close to our loved ones, that we cannot go to their funerals, that we cannot say goodbye. This is impacting us in ways that I cannot even imagine. I have been getting those phone calls from individuals who are expressing their concern. And I try to be as compassionate as I can, understanding that mental and emotional health is just as important for individuals sometimes as physical health during crises. So I want to make sure that we are reaching out and understanding that individuals are having struggles with mental, emotional, and spiritual health. I've heard from pastors across the Western region who are struggling, who want to have services, who want to be next to their flock because they want to help them through this crisis, and they are coming up with innovative ways. But it's painful not to be able to practice your faith at a time when faith is the only thing that will keep some of our residents going and keep them spiritually connected. So I want to also make sure we're understanding that everyone is looking for creative ways. To our first line responders, our physicians, my friends who are on the front line, my heart goes out to you. I really hear from you. We Skype, we do the things we need to do in order to speak, but I know what you tell me you're facing, and I really want to say thank you to our first responders as well. Grocery store individuals and sanitation individuals, everyone who is making a difference and trying to do their work and struggling with fear. People are afraid and have anxiety, and we need to acknowledge that, and we certainly do. And so know that we understand. The mayor talked about the individuals coming to Springfield from out of town or other areas of the Western region from out of town to escape places where the infection rates appear to be larger. I would ask you to please ask your relatives to social distance, or your friends, whomever is coming into your environment, please do your best to social distance for those 14 days. We want to make sure that we are keeping everyone healthy during this time, and we can't do this without the partnership of each individual, because we are in this together. Let me just say that I want to thank Patrick Sullivan and the city team, TJ Plant, the mayor, DPW. There are so many people to thank, but our tents are up and going up for our homeless population. We know what the physical layout is going to look like for the most part. We understand the staffing patterning, and so we know that we are projected to have 2 staff on site 24 hours a day. We anticipate that one will be an RN, one will be a caretaker, and we will strive to make sure that we're having an MD who is doing rounds as well. We are having another call at 3 o'clock today, but I do have the skeleton of a outline for staffing. I have the skeleton for the medical protocols. I want to thank those individuals who have worked diligently to try to put together this plan. That includes the health services for the homeless team, the health care for the homeless team, those individuals at Bay State Medical Center who are collaborating with us as well. We all care very deeply about everybody in this city, and the mayor has made an extraordinary step to say that we will build a facility, and quite frankly, it will look like a facility because of what is going into the tents and the way in which it was being constructed, and Patrick Sullivan will talk a little bit more about that. So in Hampden County, as of yesterday, there were 201 positive cases. I've told you 45 of those belong to the city of Springfield. I could not do anything that I do without the support of the Springfield Department of Health and Human Services. I thank each one of my staff individuals who work diligently every day, take these phone calls, and relay them to me and the clinical providers who do the follow-up. We will do the contact tracing to the best of our ability. I thank Superintendent Warwick for working with us to try to get some assistance from Springfield Public Schools. Clinical staff, it is important that we are all in this together. Bay State Medical Center has given us, or we have entered into a MOU with them for 2 of their TB nurses who will be working with my nurses to do the contact tracing. We very much appreciate that we have the support of a community, and you hear it over and over again. We will persevere, and we'll get through this together. I thank you very much.
Thank you, Helen. I'd also like to give a shout out to Helen's health inspectors who were out there, and Tim Sheehan's, the building code and housing code inspectors who are out there following all the proper protocol and only dealing with emergency situations, court-ordered, following all the proper health, environmental protocols. With that, I'm going to turn it over to Superintendent Dan Warwick. He'll give a brief update pertaining to schools and our continued not only meal outreach, but educational outreach and the collaboration of working hand in hand with the city side. Superintendent Dan Warwick.
Thank you, Mayor. As you are aware, the governor closed schools through May 4th, which was a very good decision, which we support, but brings on a lot of other challenges for our families that have great needs. So we're working hard to reach out to those families in many ways. On Friday, we distributed over 20,000 meals to 20,000 different students, 20,000 meals to families covering the entire weekend. So that was over 4,000 students. So again, trying to reach out in every way we can. We, with the support of the mayor and the school committee, we invested heavily in laptops across the system with a one-to-one program. Many of those were in schools that had done take-home, but in the other schools where we hadn't done take-home yet, we're now reaching out to families, and we're going to be distributing laptops so that families have that access to technology. Our teachers are reaching out with assignments, productive work for families so that we can keep students moving forward, keep them engaged. Our counselors and City CADEX coordinators are reaching out to families that have experienced some social emotional needs and trying to make sure we provide those kind of services for our families. But you know, we want to thank the mayor for his leadership and support during this time. But our staff has worked really hard. I just want to commend my staff. You know, all of our teachers and counselors are reaching out to our families in need, and that's so important at this time. Thank you, Mayor.
Thank you, Superintendent Warwick. Thanks, Dan. Again, a clarion call, because you don't want to aggravate Commissioner of Health and Human Services, Helen Caltaneris, because she will come after you. If her team shuts you down, whether a convenience store or grocery store, a meat market, or a small business, you stay shut down. And then you can open at the appropriate time once it's cleared. But if you are shut down, or else other city officials will pay you a visit, not only for your own good, but for the good of the community. So if you have been shut down temporarily, you stay shut down until you're given the clearance from the health department. With that, and then talking about public safety and law and order and compassionate ways, of course, also, is our police commissioner, Cheryl Clapprood, who has been working around the clock. I'm very deeply appreciative of each and every one of our men and women in blue who continue to patrol our streets and our neighborhoods to keep us safe and sound. Police Commissioner Cheryl Clapprood.
Thank you, Mayor. The police department update for numbers, we now have 4 officers who have tested positive. All 4 are at home and recovering at home and are doing well. I know the mayor talked to them, and I talked to them over the weekend, and they are doing well. So this morning's number, I'm down 22 officers. That just changed. I'm down 23 officers. Another officer had symptoms. He was sent home, and he will be in the testing line. So I have 4 positive. I have 12 now awaiting test results. I had notification of 3 test results came back negative. I hope those officers can get back to work. A couple of them tested positive for the flu, so it might still be some time, but I do expect them back in our ranks. So officers are coming back in, they're finishing their self-quarantine, and officers are going out as they are getting the symptoms of that may be COVID-19. So totally now I'm down 23. As the mayor mentioned, I heard from Colonel Chris Mason, and Colonel Mason, I appreciate it, and I was talking with Major Mike Habel over the weekend. I appreciate his assist. And I believe starting tomorrow, maybe Wednesday, we'll see some additional state police patrols in the city. It's to back up my officers, to make sure the officers on the street have the appropriate backup if they need help. It's to back up our manpower. They will take a backup, resourceful type of role. All of these officers that Mike Cable and I have been talking about are familiar with the city. They came from the city or have worked in the city previously, whether it's C3 or gaming unit or the task force, or they are from the city. So it made perfect sense to me, and I appreciate their help. I appreciate the help of Sheriff Nick Cochi. He called me. Right now, still, the Springfield Police Department has the manpower to patrol and protect the citizens of Springfield and to ensure safety for each other. If I can stand here next Monday and tell you that, I'm not sure. So I was grateful to the mayor and everyone else who was trying to look a little bit proactive, because we just don't know what this is going to turn out to be, and that's why the request for any National Guard assistance, the request for state police, and maybe some more requests may come out should the Springfield Police Department start to dwindle even more. But as of today, I stand in front of you telling you that I can adequately cover the city of Springfield, the businesses, the residents, and I feel perfectly calm in saying to the officers, you will all be protected. Your numbers and ranks at this time are adequate. Should that change again, I am willing and able and ready to make some other decisions, but right now we are good. Happy National Doctors Day, doctors, and thank you for what you do. Is there a National Cop Day? Let me know. Yeah, if that comes around, you know where to find me if that comes around. So we are good. We are holding our own. I am grateful to my other colleagues here that I meet with every day. They have all been of assistance to me. I am also prepared through the SPO program that started 2 years ago. I had some retired officers who are up to date on their training. I heard from about 12 to 15 of them. They are ready to assist me should I need that. Also, they can probably be very useful when the tents are erected for further security. I will let you know that a sergeant was ready to retire last week, and it's the definition of a class act. That sergeant has done his time with the Springfield Police. He has done his military time. He has served overseas. He pulled his retirement papers because now he felt was not the time to leave me. So just a definition of a class act. So thank you, Sergeant. And that's about all I have now. Thank you.
Thank you, Commissioner. The other part of the bookends here is the hardworking Commissioner Bernard B.J. Calvi, the Springfield Fire Commissioner. Commissioner Calvi?
Good morning, Mayor. Thank you. Lost my pen. So, the weekly update from the Springfield Fire Department. All firehouses are fully staffed and open. We are still closed for visitors. No outside civilian visitors are allowed to any firehouse at any time. We have 4 members currently out on self-quarantine. 1 member came back to duty today, and another member went out. So we're still at a net of down 4. So we are still adequately staffed to cover all emergency calls within the city of Springfield. A couple quick reminders like I spoke about last week. Please be careful with your cooking and candles. A lot of people are at home, cooking at home, children at home. Be careful with that. When there is a structure fire, there is no way for us to self-distance. So we are on top of each other at a structure fire, so be careful. That leaves us no way to self-distance. We're still responding to all our calls. I've been in contact with our EMS partners at American Medical Response. They're still up and running and able to handle all calls. A reminder to that, when you call 911, please identify if you have COVID-19 symptoms or if you are currently in quarantine and need additional medical assistance so all protective equipment can be done before we get to you. Other than that, we are still open for business. We're still here to serve you, and thank you very much.
Thank you, Commissioner Calvi. I call him the Wizard of Oz, Pat Sullivan. He's always so helpful, not only to the residents and business community, but each and every one of the cabinet heads here. He's going to speak about not only facility cleaning that continues to go on in our parks area, but this tenting procedure in which he's coordinated with Eversource, air purification, bathrooms, showers, barnyard. I want to give them a special thanks. I think Pat will speak about that. They've donated sheds for us for the linen aspects. They were the ones that did a beautiful donation. We built the park in memory of another brave hero, Gunnery Sergeant Tommy Sullivan. So again, I was with Pat Saturday morning, late morning, and it's just amazing, these MASH tents that are going up on that. Without further ado, the Director of Parks and Facilities Management, Pat Sullivan.
Thank you, Mayor, and good morning. This weekend, we initiated all the site work necessary on Worthington Street and have now placed 12,000 square feet of tent space at that site. We are coordinating with Eversource, Water and Sewer, City Trade Staff, Charlie Amet Trucking, and we are all working closely together to provide the necessary resources to the first responders that will be working this location. At the direction of Mayor and the Health Department, Helen Carlton Harris, we want to ensure that all of our first responders and the people that might have to stay at this location are going to be very comfortable and have all the necessary resources available to them. So we are going to be providing electrical heat with the option of being converted to air conditioning during this time. We are being able to tie into the existing sewer systems on site, water systems on site. Each tent will have hot water with sinks, refrigeration, washer and dryer systems in each of the tents. We will also have a commissary for a trailer for the staff that are working this site. They too will have their own separate bathroom, shower facilities, and be able to take the necessary breaks throughout their time. I'm very proud of our trade staff and everyone that assisted us over the weekend to get to this point. Our goal is by the end of the week to turn this over to the health department so they can start loading in and be prepared to use the resources here. As the mayor indicated, the Barnyard and Great Country Garages, they reached out to us this week, and what could they do? They wanted to help, and at that time we knew we needed linen storage on the site, so they're providing 2 shed units that will be for each of the 2 tents, and all the linen will be safely stored in there and have easy access for the workers. And again, thank you to Tim Sheehan, Jerry McCafferty, and Helen for giving us guidance during this time, to the Springfield Water Sewer Department, Charlie Amet, to Chris Signoli. He's coordinating the delivery of those units to get them through the roads of Springfield. And as the mayor said, our facilities team is doing awesome work. We have our frontline custodial staff is doing a great job keeping all of our buildings safe. But we do have an important message for our residents. You have to adhere to the safe social distance guidelines if you want our parks to remain open. When I was in here just now, I got an email, panicked, 60 golfers at the golf courses. All active recreation is closed in the city of Springfield. We will be placing logs now at the parking lots. We all have to do our part so we can protect the frontline workers and what the hospitals are trying to do in our city to keep us all safe. It is this congregation that spreads this disease very quickly. So we will continue to follow the mayor's directives and the Helen Carlton's directives as we work through this, but I just want to make it clear, all park permits, all active recreation is canceled, all events at the Carriage House are canceled through May 4th, and we will continue to give you guidance. We want to keep these resources open so you can walk and do passive recreation, but we will take whatever steps are necessary to keep the residents of the city safe. Thank you.
Thank you, Pat. What is it with you people, golfers? Adhere to what Director Sullivan said. Basketball players didn't want to adhere to it. Those hoops came down. Tennis players still want to play. Those courts are shut. Golfers still want to go out on the golf course. What is wrong with you people? I will blockade those golf courses. This is a serious time right now. There'll be plenty of time to play basketball. There'll be plenty of time to golf. There'll be plenty of time to play tennis once we will defeat this coronavirus. And that goes for gatherings of farmers markets, etc. We're being very prudent, taking this serious, and also trying to tamp down some hysteria. But please, please, talk about being selfish. Don't do it. The cavalry will be out there. Police will be out there. This is not only for the city, it's for yourself and your family members and friends. Get it through your thick head. Don't do it. Great segue to bring you up, Chris, huh? I'm going to bring up my hardworking DPW Chief Chris Signoli, and they're out there working. Let me tell you, the guys out there, they're picking up the trash. They're out there doing street work. We had a tractor trailer hit one of our traffic lights at Carew and Armory Street. They're out there putting a temporary light up there. So when you see a DPW worker out there, or you see on the trash trucks out there, beep the horn. Or if you're hopefully walking, give them a wave, give them a thumbs up, because they continue to produce, and I won't forget that. So without further ado, DPW Director Chris Signoli.
Mayor, thank you. As the mayor stated, trash pickup, recycling is going on as usual. We have had no issues at the DPW with manpower at this point. Administrative and engineering staff are on circular schedules in order to reduce the number of people in the office. This week there will be an uptick of construction that is going to be happening in the city. But since everybody's staying home, it really doesn't matter. So you won't need to see or be bothered by the construction. So water, sewer, Columbia Gas will be starting construction activities in the city, and a number of city projects will be starting later in the month, assuming everything goes as planned. We are scheduled to start yard waste pickup next week. That may change. Right now it is scheduled to start next week, but that may change. The landfill is open. If you need to bring materials to the landfill, yard waste, etc., you can do that every day. That is open. Right now, the DPW is 100% open for business on per usual. So any issues related to DPW, please get in touch with 311, and we will address them as quickly as possible. Thank you.
Thank you. Thank you, Director Signoli. Again, as I always say, the city, we're in the business of being in business, and Tim Sheen is our Chief Development Officer, and continues with he and his staff to work feverishly to try to bring direct relief to our restaurants and small business community with city money, CDBG funds. We're awaiting, I believe we'll get the okay from HUD to pump in another $500,000 to those restaurants and small businesses to try to keep you afloat until we get back on our feet. So at this time, I'll bring up Chief Development Officer Tim Sheen, and he'll give you an update on the situation. Tim?
Thank you, Mayor. My department continues to respond to the economic fallout as a result of the virus on the small business community. Friday at 5 o'clock was the deadline for applications to be submitted to the Office for the Restaurant Fund. To date, we have gotten approximately 90 applications in. The staff reviewed those applications over the weekend and is in the process of scoring those applications against the criteria that was made available in the NOFA. So we are working hard to try and get the funding out to the awardees as quickly as possible. On Friday, we announced that we had identified another $500,000 of funding that we were going to expand to make available to the small business small businesses, not just restaurants. Again, as the mayor stated, this is grant funding. We believe that these grants are essential in terms of allowing the small businesses to remain open if possible, and ultimately, if not remain open, to open as quickly as possible once the emergency orders have been lifted, and also to give them some economic strength to get to the federal funding that ultimately is going to be available as well. So we are responding as quickly as possible with the resources that we have available to us, and we should be making announcements relative to the restaurant fund soon. Thank you, Mayor.
Thank you. Thank you, Director Sheehan. Thanks, Tim. And again, these are grants, unlike with the state and the federal government, which are loans. Some, if you work it out the right way, will be you don't have to pay them back if done the right way. So in conjunction, if you do that through the city, and you should also be using those conduits on the federal funds that are going to be made available, and the state funds are going to be made available. Before we start to close for questions, and starting with Dr. Kerouac and Dr. Roos, because they have to get back to their establishments, I do whether a Solicitor Pakula, Ed Pakula, Attorney Bill Mahoney from Labor and Human Relations, HR, Human Resources, and I know TJ Plant, he's probably doing some finances now. If there's any updates, and gentlemen, I appreciate you and your team's efforts. Bill, anything?
Yeah,
Yep.
real quick.
Bill Mahoney, Director of Labor Relations and Human Resources.
Yep. I just wanted to, from a human resources standpoint, I haven't done this before, but I think it's time that I do it. I just want to thank our city staff for what they are doing day in and day out. It's, in these times, it's just phenomenal that these men and women are showing up daily, they're getting their jobs done, they're going home to their families at the end of the day and then coming back and doing it again. And I just, from the bottom of my heart, I want to thank them. Our 311 customer call takers, customer service reps, every day showing up, answering the phone, getting the information from the public and back to the public to help them out. Of course, our police and fire, who we've talked about a number of times, who you don't see sometimes in our emergency services, our dispatchers. They're showing up 24 hours a day, running 3 shifts for both police and fire every day to take your calls in an emergency and help you out when you need it the most. Our housing and building code inspectors showing up every day, taking care of the emergencies that have to be taken care of in the city. Our solid waste workers and our streets and engineering, our streets and traffic workers from DPW doing phenomenal work every single day, helping us out. Our engineers. City Hall is closed to the public, but the City Hall staff is here. We're here on a skeleton basis, and they're taking care of any emergencies that have to be taken care of for the public, and they're doing an awesome job. Our school staff, our parks, and our facility staff, all again stepping up in these times. And I just want to say, as the HR director for the city, thank you very much to all of you for the hard work you're doing, and God bless you and your families.
Thank you, Director Attorney Mahoney. Appreciate that, and I want to give a shout out to my internal staff too. That that's 24/7. That's of course my Chief of Staff Tommy Ash, Carolyn Jackson, Molly Shea, Minnie Marrero, my Communications Director Billy Baker, and Demo Austero Moss, who have always been there for myself and the city at my beck and call. And I want to thank my family, but I also want to thank each and every one of city employees' families, because as Attorney Mahoney said, it's a trying time. But like the other natural and man-made disasters, once it's done, a lot of relationships are even more solidified because everybody came through. So with that, I'll open it up to questions. Any questions, though, if you could first, if it had anything to do with Dr. Kerouac of Bay State Medical Center or Dr. Roos of Mercy, that way they can get back to their important duties that they have. So I'll open it up to any and all questions. Yes, Ms. Russo.
My first question is for both of them. I think a lot of people are seeing the situations going on in New York City, and
I'll have Dr. Kerouac come up, and then Dr. Russo.
I think that a lot of people are wondering, as you're
We have 130 ventilators currently, and we have 45 more on order. We currently don't think that we're going to wind up short, but you never know. You know, I think we have the advantage of having seen what happened in Seattle and New York to do our preparation and also to encourage everybody to take it seriously.
Thank you, Dr. Carroll. Dr. Roos?
So we are assessing our ventilator capacity both locally and regionally and redistributing resources where needed. At Mercy Medical Center, we have 43 ventilators right now, and we have currently have significant capacity to treat those patients.
I should also add, if I could, we also conduct a weekly call with all the CEOs of Western Mass hospitals, not only Mercy, but Cooley, Holyoke, Shriners, and Berkshire, to make sure that nobody has more of what they need and that everyone is distributing resources appropriately. And it's been a good planning exercise.
Well, I've got a question for both doctors as well. Dr. Kerouac, a couple weeks ago you said that about 200 employees have been quarantined. Can you give us an update on that, and have any of your staff tested positive for COVID-19?
Yeah, we've decided not to release any specifics about who has the disease and who doesn't. There still are many people who are out awaiting tests and with symptoms and that sort of thing, but I can't be more specific at this time.
Yes, I would acknowledge the same policy applies for Mercy Medical Center and Trinity. We're not commenting on specific numbers. We do have some staff that are out and quarantined with symptoms, some being tested, but no further information at this point.
Any other questions for Dr. Kerouac and Dr. Roos? Yes.
I don't know if you, Dr. Kerouac, I know a couple of weeks ago, I think 2 weeks ago, it feels like much longer, but 2 weeks ago we went and saw you guys constructing the new triage center outside, and I was just wondering if you guys had any updates on how it's been going, how it's been functioning, and any changes that you foresee.
Yes, it went through a test run late last week. It's there, it's ready to go should we need it. It's got 30 some odd bays for rapid turnaround testing. And again, obviously every piece of the puzzle has to work. You have to have rapidly available tests and all that sort of thing, but it's ready to go when we need it.
Any other questions for Dr. Kerouac or Dr. Roos? Say again? Okay, I'll let them be able to go. Thank you, Dr. Roos. Thank you, Dr. Kerouac. Godspeed to you and your families and each and every one of your doctors and staff. We deeply appreciate what you're doing. Again, a lot of the things you're hearing right now is we're trying to be proactive and get ahead of the curve, ahead of the surge. We're witnessing what's going on across the world and the country where places are getting behind the 8 ball. So that's why this is just like a chess match here. We're making these, you'll see down the road, hopefully we don't have to utilize them. Hopefully I'm wrong, because if things are better, that means we did our job. But we don't want to be put in a situation that you see other countries, states, and cities going through right now. So we're trying to be very, very proactive. I don't know if there's any other questions or comments. Yes, Ms. Russo.
Just because both you and Helen did bring it up.
Sure.
I know you guys are working to trace and do contact tracing.
Yes.
Both of you brought up New York and
Yes.
coming from New York to Western Massachusetts. Do you guys have any documented cases of that happening and they're being spread, or is it just like kind of a precaution that you're warning people like not?
I'm going to bring up Commissioner Helen Carlton Harris. She has received a number of phone calls. We want to make you aware of it, not only for the person traveling, but for the families and people here in Springfield. So she'll clarify a little more. That's people traveling from all other places too, but she'll clarify that. That came up in our earlier this morning in our cabinet head meetings. Commissioner Helen Carlton Harris.
Thank you. Yes, the public in the city of Springfield have been making us aware of the number of license plates that they are seeing from everywhere, but particularly from New York. So that's where our data source comes from.
I've got a question, so you don't have to run back and forth. From Friday, you said, I know I asked you Friday if any members of the homeless population had tested positive. You said that you hadn't received the information about the addresses for Friends of the Homeless. Has that changed this Friday?
There has been no change in what I reported on Friday.
Thank you.
Any other questions or
I've got a
comments?
question for the school superintendent.
Sure, Superintendent Warwick. Again, we're staying proactive, and we hope to keep those numbers down.
Am I correct in understanding that the DESE has asked school districts to do 3 hours of education a day? Is that accurate?
DESE sent out guidance to try to do as much as possible, but they're suggesting a certain amount of screen time per day, because too much screen time isn't great for students, so we're trying to work with that guidance.
So
Yeah.
it's 3 hours of screen.
Screen time, yeah, so we're trying to give activities that go beyond screen time.
So
Yeah.
is there any guidance as far as how structured this has to be? How is?
Well, the way we're handling it is this. They've given out some general guidelines. We're asking principals to work with the teachers in the building that know their kids the best and to offer guidance to each of their students and their classes as it is appropriate.
And you're making plans to get the laptops out? I know some students had their laptops at home and others didn't, right?
Yeah, we had some schools that actually were taking them home already, and we were all set there. But we're going to do a massive distribution next week, but we're going to make sure we disinfect all the laptops, and we're working with staff so they have the right equipment with our nursing department to distribute some at the school, and for parents who can't make it to the school, drop some off at the houses.
Just one last question. During this period, it's my understanding that you can't teach anything new, or you can't test. Is that correct? Because there's an issue with equal access, and you have special needs students and that sort of situation. Am I confused about that?
No, you're right on. We've got to be careful with that. So we can't grade the student work, but we want to actually engage the students in productive activities and productive educational pieces that'll be important for them. So we can do some new work. We just can't grade the work, because then there would be potentially some students who don't have access in their homes. That could be special ed students, and that would be disadvantaged, so the equity piece. But we want to engage the student in as much productive work that is appropriate as possible. And our teachers are working hard to do that.
Thank you.
Thank you, Superintendent Ward. Any other questions or comments? Again, I'm very, very appreciative of the media for getting this word out. We will continue every Monday morning at 10:15 with these full updates. We will continue to update you daily. I gave you the website prior, and our call center, 301 call center. It's 413-736-3111. If something should arise, hopefully positive, and we have to call the press together, we will, or meeting another challenge as we did late Friday or mid-Friday afternoon, we will do that. But again, Billy, it's www.springfield-ma.gov, okay? I still have an Etch-a-Sketch. Also, I know it's tough on each and every one of us to be away from our loved ones or our friends. People are getting very creative on how they can get together, but we are never that far apart spiritually. And remember that as we go forward. So please practice the social distancing. Please do those. I know you might think they're simple and common sense, but the hand washing. Again, if you're feeling under the weather, stay home. Check on your neighbors, especially if they're seniors. On that. Make sure that they're okay. I wish I had a little more time to tell you. There's been, besides the heroic efforts being put forth by the city and employees and medical employees, there's a lot of other unsung heroes out there that are doing the simple little things to help someone out or to make for a better community. That's not lost upon each and every one of us. I promise you, as we have done before through natural and man-made disasters, we will get through this together as one and for the better. You have a city team that is tested and true from cabinet heads down to rank and file. We know what to do. We ask you to do the right thing, because it could save yourself with good health or save someone else's life. And then before you know it, we'll be right back to the sense of normalcy. God bless you. God bless the city of Springfield, and God bless your families. Thank you very, very much.